This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
All right, I want you to take a look at what's around this man's neck. No, it's not just a regular scarf. He says it's a fashionable way to fight the flu. This flu scarf, or scarf as it's named, has a carbon filter mask in it to help block germs when you're in public.
You simply pull the scarf up over your face and then tighten it like that. And then the filter is right here over your mouth and nose and protects you.
Now that $20 filter lasts for up to 3 months before needing to be replaced. The scarf itself costs up to $69, but you still need to be careful. One doctor says if your eyes are exposed, you can still get the flu from a sneeze.
Yeah, and so many people have come down with it, Lisa. As a matter of fact, the Centers for Disease Control and Prevention says it has already become an epidemic this year, with almost every state reporting widespread flu activity. Let's take a look at Delmarva. According to the Delaware Division of Public Health, there have been just over 1,000 lab-confirmed flu cases in the state, almost 430 of them in Kent County, and just over 300 flu cases in Sussex County. DPH says there have been 9 deaths so far this year, all with underlying health conditions. At the same time, last year, for the past 3 flu seasons, there were 0 deaths.
Now, Maryland looks at influenza-like illness and records that based on intensity and geographic location. The state reports a high intensity level out of minimal, low, moderate, or high, and it classifies the flu as widespread. To give you a better idea of just how bad that is, PRMC reports 121 positive flu tests so far this season, compared to just 80 all of last flu season.
All right, let's go to Virginia, where the state tracks flu activity levels, not numbers. The current level is widespread, which is the highest. Widespread is defined as outbreaks of influenza or increases in influenza-like illness cases and recent lab-confirmed influenza in at least half of the regions of the state. Virginia does track influenza-associated pediatric deaths. They have 3 right now, which means the flu was associated with the death. Now, you may be thinking to yourself, a lot of people got the flu shot. So why is this season so bad?
Well, government health officials say the vaccine may be only about 30% effective this year because the main strain circulating, H3N2, is not a good match to the vaccine.
In the average year, we see an effectiveness of the vaccine somewhere at 50 to 70%. And so it might be a little lower this year, but even if it's lower, it may provide some protection, especially important in people who are at high risk of severe disease.
The H3N2 virus tends to cause more severe illness, especially in very young children and the elderly. Doctors say there are usually more hospitalizations and deaths in years when the virus circulates.
So with this year's flu shot only offering limited protection, you may be happy to hear that there are some extra precautions that you can take to protect yourself and your loved ones from getting sick.
Third floor, like in Home Alone.
Parents already have a lot to worry about, and this time of year on the top of that list is keeping kids healthy during cold and flu season.
I always tell the boys to make sure they wash their hands, don't share food or drinks with anybody.
But the Centers for Disease Control and Prevention says this year's flu vaccine may not protect against a strain of the virus that's circulating around the country.
I don't know that the flu shot's ever really 100% effective since they base it on the previous year's strain.
But health officials say don't skip this year's flu shot, and it's better late than never.
There's still a good amount of protection with the unmatched vaccine. So it's very important, even in those years that there is not a perfect match, to still get your vaccine.
Even though the flu shot's not as effective this year, there are still some simple things you can do to protect your family. Typical tips apply. Wash your hands with soap and water. Stay home from work or school if you're showing early signs of sickness. And wipe down those surfaces that are touched often, like your desk, doorknobs, and toys.
Here's the other part.
And as for parents, health officials say take this time to teach your kids the importance of washing their hands at home and at school.
And unfortunately, it doesn't look like the germs are going to disappear anytime soon. We've still got a couple of months to go, as flu season usually lasts all the way through March.
All right, well, let's learn a little bit more about the flu and how to recognize it should you or a loved one start to feel ill. Joining us today to help is Dr. Snyder, Chief Medical Informatic Officer and Hospitalist at Peninsula Regional Medical Center. Thanks for joining us this afternoon, Dr. Snyder. Now, as we heard, it's a bad season. I've even heard people say it's the worst on record. Are you seeing that?
Yeah, we're actually seeing a fairly large volume come through the emergency department. We're screening a lot also, obviously, so we have rapid testing we can do, and they're assessing that. But yeah, absolutely, we're seeing an uptick and dealing with those issues associated with the, especially the elderly and the young.
Do you think we've peaked out yet?
No, no. This is early in the season, so you know, again, it's hard to say when the peak is when you don't know when the end is. So, but I suspect we're just getting into the flu season, so it's really unpredictable.
That's not good news. Now,
No.
I understand there are certain groups of people who are at higher risk than others. Who are
Absolutely. So your sick are probably the primary group that we concern with, but folks under 5 and over 65 are really the key folks that we're targeting. Everybody's susceptible to it, but unfortunately, it's not predictable as to who's going to get it. Early symptoms, you know, respiratory, in children, you got to look for diarrhea and stool problems. Those are probably your biggest areas that you're looking for early signs. But again, I think if everybody's just aware and takes care of themselves, good diet, good nutrition, exercise, and watch your exposures. The hand hygiene, I love seeing those pictures because that's so important in healthcare environment, but also at home and in schools.
Yeah, number one. So is there any way that we can know whether or not it is the flu or maybe just a cold?
No, they're very similar circumstances and symptoms. So basically when the patients get their illness, as fevers progress and the achiness gets worse, common cold usually has some achiness, but it's usually 2 or 3 days long. The flu will last much longer. Usually if you've had an illness for 3-4 days, you know, I think those are the things that you want to look for. The body aches, the low-grade fever is the early start of it. The higher temperatures is where I start getting concerned, and when you start coughing and getting respiratory problems, that's the time you need to get checked out. And it's a fairly rapid test now, so you can evaluate folks for this, but you know, the treatment options are limited. There are some medications to help reduce the virus, but it won't absolutely kill the virus. So,
Now, you mentioned some serious symptoms such as the heavy coughing and the high fever. Are there other symptoms that we need to know to just get to the doctor?
yeah, any of the flu symptoms that are described, it's called coryza, runny nose, respiratory problems. And then again, I get concerned when people start seeing, especially in the elderly, the mental status changes that occur. So when people, they get more confused, that's sometimes an early sign for an elderly person. Children just don't have the activity, they become lethargic. Those are really ominous signs that we need to see them fairly rapidly, and that would be the folks I would bring to the emergency department.
Okay, so one of the ways of detecting it now is a nasal swab. The FDA has approved. What do you think about that?
Yeah, so it's a cotton swab that we actually use to actually run into the nose. It's fairly quick, and then they put it into a medium that allows it to grow and identify the virus. So those cultures are just, again, a screening tool. The symptoms, it really is a rapid way for us just to identify somebody who's at risk. The treatments, early intervention with antiviral medications really will help reduce sometimes the bad outcome.
Now, it's not too late to get your flu shot.
Nope.
You have a flu clinic coming up at PRMC?
Yeah, it's Wednesday afternoon, so and it'll be 3 to 6 at the Avery Hall Ed Center. And phone numbers there, but it's, yeah, get the flu shot. It protects you not from all the H3N2, excuse me, is again a variant this year that we're dealing with, but the other flu bugs are still out there. So you still get protection from those, and it's very important. It's all about exposure with these viruses, so it's how you get exposed, when you get exposed.
So you've got to be 13, and they're requesting a $10 donation as well. Yes. And there's also been modifications to the visitation policy at PRMC.
Yeah, and this is tough to do, but we're really trying to limit it to the 2 adult visitors at a time, kids under 18. And the reason for the kids is because they're in mass groups. So when they're in school together, they tend to share and carry, and they may not even show symptoms. Early symptoms, runny nose, cough, any of that, please try to avoid coming into the hospital. But our visitation rights are, again, to protect our patients and your loved ones while they are sick. The sick are absolutely the highest risk for mortality.
All right, and when you're greeting someone, you are not being rude if you don't shake hands, just do a nice little elbow bump.
Yeah, and use those alcohol scrubs.
Yep.
It's very important. You know, wash those hands and get, every time you're in the store, Walmart has them, a number of different places have them. You can see it pretty much everywhere in the community. Hopefully they're being filled. And you can touch it as you go by.
All right, Dr. Chris Snyder, PRMC, thank you so much for coming in today. And to read more from PRMC about flu prevention and tomorrow's flu clinic, go to WBOC.com, click on our picture at the top of the page.
Okay, so when you do get sick, whether it's the flu or something else, where do you go? For instance, heart attacks, serious burns, broken bones, very serious. Emergencies, but some health issues are a bit harder to call.
Yeah, from pink eye to poisoning, here's where and when to go for care for your ailments.
For absolute emergencies requiring immediate care, always know the location of your nearest hospital. For injuries such as major head trauma, coughing up or vomiting blood, severe burns, unexpected paralysis, suspected poisoning, or even emotional distress, including suicidal or homicidal feelings. An urgent care center can treat an illness or condition within 24 hours to avoid further disability or death. Conditions such as rising temperatures, stomach flus, sprains, strains, earache, and sore throats. An Express Care Center typically treats teens and adults. They are usually available after hours and on weekends as well, treating common problems such as seasonal allergies, minor cold and flu symptoms, pink eye, sinus infections, and UTIs.
And don't forget to go to your doctor's office for routine checkups. Also, all of these should be preceded by preventative care measures with your primary care doctor. They will have your medical files, history, and can usually meet you in an urgent care emergency situation.
So plenty of us ward off disease by protecting ourselves from germs. Up next, we're going to hear some ideas on how to ward off germs while you're at work. You're going to find out just what it takes to stay away from the yuck making its way around your office.
Plus, we hear 5 natural cold and flu fighters, how you can protect yourself and your family this winter with a few simple ingredients found in your pantry.
And we are in the Delmarva Life Kitchen learning about the latest in wine blends. Plus, we're going to learn how to make a beef in red wine sauce. Delmarva Life will be right back.